Welcome back, student, again for a very short video on the floating rib. This rib is the 12th rib. Sometime if examiner wants to ask you and you had replied very well, then only they will ask you this floating rib. The floating rib is a small rib with the pointed tip here, which shows a cup-shaped anterior end where the costal cartilage is attached. On the medial end, there is a rough round circular area, articular area for articulation with that of the 12th thoracic, because this is 12th rib, okay, the floating rib, 12th. And then how to identify the side? Just to keep the bone in such a way that its upper border is almost rounded like any other typical and lower border is sharp. Sometimes a very faint groove is present near the inferior border, that is subcostal groove, otherwise it is absent. The outer surface is rough for muscular attachment and the inner surface is smooth. But then you should keep for anatomical position and side determination that the anterior surface of the medial end and medial part of the shaft of the body should look upwards and forward. It should look. And for anatomical position, the same thing, medial end should be at a higher level and that of the lower end or the anterior end should be at the lower level. But important is that the inner surface should face upward and forward, then only you can determine the side. This is of the right side, right 12th rib. If you will keep it like this, no, it cannot. The anterior surface cannot face upward, and then the sharp margin is onto the upper border. So it should always be kept like this. So this is the 12th rib. Lot of attachments are there onto the lower margin of this rib, 12th rib, okay, 12th rib, right? Thank you very much for watching this floating rib. Thank you.